Hello everybody, this is the Learning Lab. My name is Roman Garcia. This will be the first video we make for the new year. So what we're going to start emphasizing is discussing issues that have to do with evaluating musculoskeletal conditions. For this first video in the new year, we're going to be discussing a concept, a paradigm that maybe now is not being used because it's really not recognized by the medical community, but it's going to be an issue, or it's going to be an idea, a concept that I think in the future is going to be a means or a method or a biometric method that's going to be used in evaluating knee issues. And the primary concept that I want to discuss today is the idea of pliability. Now, the word pliability means something that conforms, that adapts, that changes depending on the stresses that it's exposed to. Now, joints have that quality to them. They have pliability. Now, it would be fantastic, or it would be very advantageous to the diagnostic process if there would be some way that we can measure, that we can quantify the concept or the idea of pliability. And what I'm going to show you today is how to do just that. And this is what we do in our clinic. And I believe we are the only ones that are working with this idea of pliability. And we developed an X-ray facet, a component of an X-ray done on a knee that illustrates or measures or quantifies, even qualifies that idea of pliability, which we use in order to predict arthritis of the knee or to establish how involved a knee is. So what I want to do first is I want to show you an X-ray of a picture of a joint that has substantial pliability, and how it is that I know that. Now, this first picture that I'm going to show you is of this is a simple X-ray, an AP X-ray of a knee. Now, this just so happens to be a patient that we saw. This is a 15-year-old male. Obviously, any person that's that young, 15 years, anyone before 18 years of age, you would assume that they have quite a bit of pliability in their joints. In other words, they have the ability to jump up and down, to fall from elevated heights that someone older may not be able to tolerate without damaging. And the reason is because joints in a young individual have tremendous amounts of pliability. They have the ability to adapt to any compressive load. Now, what I'm going to show you is what exactly pliability looks like on an X-ray. What identifying feature of an X-ray tells me how much pliability exists in the joint and how it can be used to predict osteoarthritis in a knee joint. So as of right now, when you go to your medical provider with knee pains and they take an X-ray, they are using methods that have been established 50, maybe even 100 years ago. Their level of understanding of what they're looking at on an X-ray has not improved in the last 15 years. So as of right now, when you go to your orthopedic doctor or to your general practitioner and they take an X-ray of your knee, trust me, you are not getting all the information that an X-ray gives or allows for an experienced observer to wean from the X-ray. The only person that's able, the only facility that's able to do that is we. Because we have established this protocol to quantify and qualify the amount of pliability in a knee joint. Now, the way that we do this is simple. We look at the growth plate. Now, this 15-year-old male, this X-ray demonstrates a knee, a body that is still growing. And the way that we know that is through this little this line, this white line. This dense white line right here. this dense white line. This dense white line, all this means is that these sections that this line divides, this section and this section right here, and even this section right here, all have different amounts of pliability to them. That's the way the knee joint is designed. So as the joint is being stressed, that stress is being dissipated among the different sections. Now the interesting thing is that as an individual gets older, they do not tend to lose this line right here. I've seen this line in healthy knees of an 80-year-old. So this line does not disappear with age. But where it does disappear is when a joint is under duress, or it's in an inflammatory state, or it's in full-blown degenerative state. That's when you start seeing this line disappear. You may even be able to see lines, missing lines, or lines that are fading away in knees that are not symptomatic. But that means is that that knee, it's under duress, though the individual does not experience pain. But when I examine them, there is always biomechanical markers which tell me that the knee is under duress. And when we take the X-ray, we always see this line starting to disappear. It's basically becoming ossified. Now, in this 15-year-old, he was experiencing pain in one knee. He was experiencing pain in the left knee. For reasons that we're not going to discuss here, there was a reason why he was experiencing pain. Yet, this joint still has, this male individual still has tremendous amounts of pliability because this growth plate right here is still open, which allows him tremendous amounts of that pliability in the knee joint itself. Now, what I want to show you is a knee that's in a full-blown degenerative state. This is a knee that's obviously very arthritic. Now, the interesting thing is that, as you can observe, I made these little marks over here, but we can look through these marks. This knee, the right knee, is more involved than the left knee. Now, if you try to look for that growth plate line, it's missing completely. There is no growth plate line here, which means is that this joint has no pliability whatsoever. I would be assured to say that before this individual started to experience degenerative changes in the knee, if someone were to have taken an X-ray, they would have started seeing this line very faint. If this individual would have had that information, this would not have happened to them, because he could have been told that he was on the road to degenerative changes. But obviously, that information yet is not being utilized in any medical center except ours. Now, the interesting thing is that this knee right here, the left knee, was less involved. And you can still see, it's almost gone completely, but there is a faint growth plate line right here still. On this outer half of the knee, there is no growth plate line. It's completely obliterated. This growth plate line, this pliability area right over here is completely ossified. This one is almost totally ossified. I'm going to show you on X-rays some recent cases that we've seen, and you'll be able to appreciate the difference in this growth plate line among an involved knee and one that's not involved, or a knee that's on the road to degenerative changes. So these patients that come to us, we're able to predict if they are going to suffer from degenerative changes based on that growth plate line. Now, what I'm going to do is I'm going to come right over here with the help of my assistant Anna, and I'm going to show you where the growth plate line is. We've done this in past video, but I'm just going to go over it again. But before I do that, I just want to let Anna say a couple of words.
Hello, everybody. Happy New Year. I come back for make the new video.
Okay, now let me do this now, and let me show you where the growth plate line exists. Now, we have an X-ray for Anna, and I'm going to show you an X-ray of Anna so you can see where she is on the probability scale for developing degenerative changes. We already know that Anna suffers from knock knee. So we monitor her knee on a continuous basis. And one of our monitoring metrics is that growth plate line, which is hopefully in the near future is how all orthopedic centers create a profile of their patients, not neglecting that growth plate line, which is very important because it's a line, it's a metric that has probability importance. As far as if that person, it has greater or lesser probability to develop degenerative line. You got to follow that growth plate line. It tells you the amount, the quality, and the quantity of pliability in the tissues. And based on that, you can give the individual, your patient, or the person, some advice on what not to do and what to do, knowing that their growth plate line is being obliterated, is being ossified. Now, the growth plate line in most individuals will lie, relax here, the joint line is right here. The joint line of Anna is right here. This is the joint line. And then this is the medial, and then the lateral, it's approximately right here. The joint line, the growth plate line, that pliability line, that line that can be seen on an X-ray, will lay about, maybe about 1 inch below the joint line. 1 inch to 3/4 of an inch below the joint line. It will lie right here. This is where you would see it on the X-ray. It would be right here. Even in knees that are 80, 90 years old, that growth plate line is always there unless the individual is on the road to arthritis or has already degenerative changes in the joint. As the degeneration gets worse, the growth plate line starts to diminish. You lose the ability to see it on the X-ray itself. But even before the symptoms start, you'll start seeing changes in that growth plate line. So it's a great predictive measure that the observer, the examiner, can use to predict osteoarthritis in their patients. Now, I want to come over here and I want to show you some cases that we've done recently so you can see the difference. Now, this is right, this is left. Both knees were involved, but one was more involved than the other. And again, we know that both knees are already losing the pliability because the growth plate line cannot be observed easily. And you can see that on the more involved one, the line is ossified completely. The area is ossified. That's this area right here. You can still see a very faint growth plate line right here. But this person still has lost pliability in the knee joint itself. On the less involved knee, symptomatically and clinically, the joint space, the growth plate line is still observable. You can still see it. On the knee that's more involved, it's completely ossified. So it's consistent. The growth plate line, the more involved the knee is, the less you see it on an X-ray. Now that's one case. I'm going to show you another case. These are some pictures that I've done here. Now, this individual came to us pre and post ACL tear. She's been experiencing joint pain for a while before this ACL tear. Now, what happened is she developed an ACL tear. But before that, she was experiencing pain in both knees. She had gone to the doctor and they done an MRI and they established that she has degenerative changes in the knee itself. Now, the interesting thing is that on the left knee, you can see that there's still a lot of cartilage here. But the growth plate line is very thin. You can see it's right here on the left knee, which is where the ACL tear did not occur. The growth plate line is almost non-distinguishable. It's basically ossifying on her. That explains why she's having pain. Even though she has a lot of cartilage, she's lost pliability in the joint itself, in the bone tissue itself. So again, knowing this, knowing that she's losing her growth plate line, she's been given recommendations on what to do, what not to do. But if you don't pay attention, if you don't give importance to this growth plate line, when you see this x-ray, you would assume that she has plenty of cartilage and her knee is relatively healthy, but it is not. These knees are losing pliability. And she's not that old. She's in her early 40s. So it's happening to her in her early 40s. Now, this is another case here. This is the right. This is the left. Again, this is a man in his late 20s. Someone you would not expect to have knee issues. Yet, he came to us with knee issues in both knees. Now, you can see that the growth plate line is still visible on both. Still visible, but it's starting to become ossified in the late 20s. This individual, even in their late 20s, which you would not assume that they would have pliability issues or knee issues, is starting to experience loss of pliability. He has plenty of cartilage still, yet he's losing pliability. And the only way that you know that he's losing pliability is if you follow the growth plate line. This growth plate line should be more distinguishable, considering that he's in his late 20s. He's not old, he's very young. The growth plate line should be as marked as that 15-year-old x-ray from that 15-year-old boy that you just saw earlier. In the late 20s, he's too young. So this individual was given proper instructions based on that. And now, this is another recent case. This is the left, and this is the right. This is the most telling of all x-rays of my position on this growth plate line. How important it is for an examiner to pay attention to this growth plate line. Now, this individual came recent to me, so my memory of his case is very clear. He came with right knee issues. This is the right, this is the left. The left knee was non-symptomatic, biomechanically was healthy. The right knee was not. The right knee already showed clinical symptoms, clinical signs, biomechanical signs of degeneration in it. I was able to measure it already. This individual was in his early 30s. Again, very young. You would not expect the growth plate line to be thinning on him. He's still very young. Now, this is the interesting thing. This is the uninvolved. This was the involved. If you observe the growth plate line on the left knee, you can still see a very clear line right here. It goes from the inside and it goes almost all the way to the peripheral of the lateral side of the knee. Now, on the involved knee, you can see that this line is very thin. It's not as you cannot appreciate it as much as you do on the left. The left, you still see this really clear white line, this growth plate line. Not on the involved knee. You can see the growth plate line starting to diminish. It's harder to see. It's thinning out. It's ossifying. Again, this individual in his right knee, he's losing his pliability. Again, this is the initial in x-ray. A hypothetical would be, if he comes back to us, we would monitor the growth plate line and in this individual. As the knee gets healthier, this growth plate line will become more observable on x-ray, giving us the assurance that the knee has reestablished pliability. And the only metric that will tell you this is that growth plate line. Again, again, the field of orthopedic medicine, of examining joints, has not really advanced much since I've been in the field, which is 25 years now. It has not advanced any. We're still using old metrics, old paradigms, looking at the joint space width, looking at the loss of cartilage inside the knee joint. Now, it hasn't changed. And the reason that it hasn't changed is because doctors, facilities, societies, cultures in general, when something is working somewhat well, they tend to stay with it. Now the problem is that in medicine, when that happens, people suffer. And the advancements of understanding of biology suffers. So we've taken upon ourselves to develop a new paradigm, new metrics, that we know are factual because we see it over and over again. These are objective measurements. Now, the only way that you can, if you're out there and you're watching this video and you really want a clear understanding of what's going on in your knee, just contact us. Every video gives information on how to contact us. We have established a very objective protocol, hopefully, to propel the orthopedic profession to the future. We want to create a new paradigm, objectify the act of examination. Again, for anybody that watches this video, if you're interested in contact us, as I said before, we always put our telephone, our email address there if you want to contact us. If you want us to answer questions, there's products that we have that we believe are the best in the market. If you have any questions, always feel free to give us a call. And for anybody who watches this video, thank you very much. Until next time.